In health indicators on maternal health, maternal mortality, the death of women, and the illnesses of women have not changed in the past 2 decades. This kind of indicator shows the disparity between the rich countries and the poor countries, and the rich and the poor within the same country.
Every year, more than 500,000 women die from pregnancy-related complications. In the Philippines, such cases claim the lives of 11 women daily. While 92% of the rich can avail of delivery by skilled health professionals, only 25% of mothers in the lower social bracket have access to the same services. 87% of those who avail of services of skilled birth attendants have college degrees. 10% have either low educational attainment or none at all. 73% of those who deliver in health facilities have college education. 6% don't. On average, rich women give birth to 2 children, almost equal their desired number. On average, poor women have 6, 2 children more than they desire. Children who have lost their mothers are up to 10 times more likely to die prematurely. Maribel Ido has just learned she is pregnant again. She is one of nearly 2 million Filipinos who will get pregnant this year without intending to. Maribel already has 5 children, and times are hard. Where Maribel lives, public clinics offer contraceptives, but in many other towns, they do not.
If you're rich, you don't need the services. You can buy all the services you need. But if you're poor, you've got to have state assistance.
The Philippine Congress has allocated funds for family planning in the 2008 budget, but local government units are finding it hard to access it. The government supports natural family planning, which is approved by the church. But women's groups want to expand the options.
Natural family planning is not a choice of many Filipinos. When you look at the surveys, you only have less than 1% of the population actually desiring natural family planning. So that's a problem. The second problem is natural family planning is not as effective as other family planning methods. 3 of 10 women using natural family planning will have pregnancy.
Buntis na ka, di mahalo na mo gihapon kay makasa, diya kang imong kuan mo ipakuha mo kintay simbako.
Surveys indicate that poor women have, on average, 2 children more than they would like. This makes it harder to make ends meet.
Usahay lagi makasa, di dyan ibut-but ako, di na lang kumukaon. Haw na lang yung ipalabon sa ako ang mga anak, ug sa akong bana nga nagtrabaho, kay ako, may kaso na ho, kay naramang ko sa bahay. Inig kautog, makakita kong bugas, pintahon na lang po na hog kaon.
Ensuring access to voluntary family planning could help families escape poverty.
If you can help women prevent pregnancies, then they won't be exposed to the risk of pregnancy that kill them.
A majority of poor Filipinas give birth at home without medical assistance, and maternal mortality is high as a consequence. Ensuring skilled attendance at all births, backed by emergency obstetric care when needed, could reduce maternal deaths by about 75%. A bill in Philippine Congress seeks to ensure government support for family planning, skilled birth attendance, and emergency obstetric care.
Because if we have this law, then family planning would enable women and couples to really space their children. It would reduce the number of risky and unwanted pregnancies, which result in maternal mortality and infant mortality, and even to abortion. So that would be very important for the country to attain the Millennium Development Goals.
We know what needs to be done. 3 simple interventions: skilled birth attendants, emergency obstetric care, and family planning would save a woman from dying. No woman should die giving life. We call upon all governments, all NGOs, all UN sister organizations to invest, to scale up services for women, so we will never hear again that a woman is dying because she's giving life.